Hi, this is Dr. Singh, acupuncture physician, herbal specialist, food therapist, and more. The purpose of this video is strictly for educational purposes. I'm going to be focusing today on herbs versus modern day medicine. There are times people are taking medications because they need to take the medication because they want to take medications. I do not take medications. It is your choice what you want to do. I am strictly involved with herbs and a natural way and a natural form of healing. First and foremost, we're going to start this way. It's very important for me to disclose this, that again, this video is strictly for informational purposes. So let's get on with this. The first doctor is noted to be Imhotep, and I've done a video on Imhotep. However, the first, or I should say the father of medicine, is Hippocrates. When I talk about these medications and I refer to herbs, I want you to carefully understand that it's recorded in writing. There are many, many herbs that were used previous to this, what I'm going to say, but maybe it was not documented in certain societies. So keep that in mind. So on the record, and most of this information I'm giving you comes from a book that deals with becoming a pharmacist. It's a pharmacy technician book. It is agreed that the white willow bark is the first documented type of herb that was used for the treatment of pain. This particular item, which is the white willow bark, it was utilized for the treatment of pain, and the chief ingredient in that particular herb is the salicylic acids. In the white willow tree, it's known to have grown in the Mediterranean in the 1800s, more than 2,000 years after Hippocrates' time. Again, the bark, the chief ingredients is salicylic acid. Chemists decided to extract this acid. And what we know today is aspirin, modern day aspirin, which is a salicylic acid. acetysaliclic acid. I want to be very clear with that. So aspirins derives from the white willow bark. To put it to you in a nutshell, that is typically prescribed for people who need to have a thinning of their blood, for certain types of pain, aches and pains, and etc. So if you're taking any kind of aspirins, ginger is something you don't want to drink at the same time because that is a natural sort of a blood thinner. So be very careful and be very vigilant with knowing that if you're taking aspirins, you cannot take, or it's not wise for you to drink ginger because it does have the similar effect, but that certainly comes from a plant and an herb directly. Currently, we know that aspirins, it does over time, it does actually erode the lining of the stomach. The next item that I like to discuss is the Peruvian Cinchona tree. Now, what was this Peruvian Cinchona tree used for? It was used in the treatment of malaria. And this particular tree, it was popularly called the Jesuit powder for the Spanish priest that was sent to Europe, which is the New World, to be used for the purpose of the treatment of malaria. The main ingredient from the Cinchona tree that we know now today that scientists have extracted is the quinine, the natural quinine. Every medication, I would have to say 99.9% medications, comes from some sort of a plant, a tree. It comes from something in nature. So you're actually getting an item, if you are exposed to medications that derive from some sort of a plant, and then the chemist utilize the chief ingredients in that particular plant or herb to make these different types of medication. Next, the cocoa or the chewed cocoa leaves. That we know today, it was the leaves that was used for the purpose of endurance. Now, what we know today is that modern day medicine, we understand that cocaine is what was taken out of that particular item, or the chief ingredients out of that cocoa leaf. And that was used for the purpose of surgery, anesthesia, so you're not feeling pain. Also, in dentistry. In 1884, it was shown that it had the first effective local anesthetic by Carl Kohler. He's a Viennese surgeon. And that basically revolutionized surgery and dentistry. Again, that comes from what the Indians of the Andes were chewing, which is the cocoa leaf. And again, cocaine, as you know, as a drug that's utilized in the market for people who want to take illegal drugs. But again, that is the chief ingredient that's used for anesthetic purposes. Just a little footnote for you. I know that a long time ago, and you could check this out for yourself, that it is said that cocaine, it was utilized, I don't know about now, was utilized in some form of beverages. Think about all the beverages that you know that has that name, and you'll be able to figure that out for yourself. So we've covered so far the white willow bark tree. We've also covered the other item, which is the Cinchona tree, the Peruvian Cinchona tree. And we're now talking about the cocoa leaf. Cocoa leaf regarding anesthetics, malaria for the Cinchona, Peruvian Cinchona tree, and the white willow bark utilized for pain. And again, that's where you derive from for aspirins. Foxglove. Foxglove, it is known to be utilized for the purpose of treating heart disease. It contains, it has a digital, that's for the effect of the heart. And in 1785, it was a British physician. His name is William Withering, and he published a study of the foxglove plant, and the drug, it contained digitals. This became a widely... So foxglove was utilized by William Withington, and his published study of how this could be utilized in the treatment for heart conditions or heart disease. Now, foxglove, it has history because since the ancient times in a variety of remedies, but it's said that Witherington, he described a process for creating the drug from the dried leaf and the plant, and then he administered a dosage approach. The next item is a species of a Mexican yam. Russell Marker in 1943, he created this hormone called progestrone and is considered to be the first reliable birth control drug. Again, that comes from a species of a Mexican yam. So we could conclude that nature's medicine comes from real life plants, barks, herbs coming from a tree, and certainly leaves. There's a particular plant, or I should say a root, is called Sarsaparilla. And this particular plant, from about, let's say, I think it's mentioned from way back around in the 1500s, the Indians of Mexico, they had established a pharmacology, and it included about 1,200 drugs, and it was a result of many hundreds of years of medical practice. Sarsaparilla, it was introduced to Europe for the treatment of kidney and bladder ailments. And today we could see it in a lot of herbs. And that's basically where we're at when we're coming to herbs. It evolves, people find out more information because of time, use, and documented or oral conversation of experiences. Nature, which are plants, versus compared to modern day medicine, which of course chemists are involved when it comes to that. We cannot get rid of, or we cannot ignore the fact that the modern day medicine, which are considered as drugs, that they do have some chemicals in order to extract the natural function or the natural activity of that particular plant. When it's utilized with chemicals, then it becomes some sort of a drug. In terms of history, we recognize the Sumerians, the Africans, Imhotep. We're also going to recognize the Greeks, Indian physicians from India, Persia, China, also widely used in Europe. Most of this information clearly states that all drugs, or mostly all, 99.9% drugs, derives from a plant or a tree or a leaf, something involved with nature. Modern day medicine, that evolved from the Swiss alchemists, Germans, certainly in the United States, and it keeps going. Most interesting, let's review all these different herbs and what the uses are. The Mexican yam that was utilized for the purpose of extracting from that yam for hormone progestrone, dealing with birth control. Foxglove, another plant that's utilized for heart conditions in that particular medication. Sarsaparilla, they used it in Europe for the purpose of kidney and bladder ailments. Then we have, for anesthetic purposes, the cocoa leaf, which you get cocaine from, and that is the chief ingredient for anesthetics, dealing with surgery or any oral type of surgery done to the mouth as an anesthesia. For malaria, we've got the cinchona tree, the Peruvian cinchona tree. The active ingredients is the quinine, and that's for the treatment of malaria. And we started out with the white willow bark, which the chemists extracted the salicylic acids from that for the purpose of making aspirins. If you're interested in viewing information about herbs, we are going to take out time for educational purposes. We're not prescribing it to anybody. We're not recommending it to anybody. It's for the purpose of educational purposes. Please take the time to click the subscribe and the bell, and also share this video with a friend.